Just as the flapping of a butterfly's wings can cause a storm 1,000 miles away, so can the actions of a single person create a legacy that transforms a community for generations. This is the story of one such person.
I think I have always grown up knowing that we come from a family that's had strong women, and so I've always grown up not wanting to, pay attention to society's rules and thinking that, we're strong women and those rules don't apply to us.
We could do whatever we want.
Yeah.
This idea that whatever I want to do, if I try and I do my best, I can accomplish it and nobody's going to hold me back, and it doesn't matter that I'm a woman or, she served the community and she served people, and I see that in my cousins and myself, her great-granddaughters, that we have these jobs where we are out in the community and we're helping people and we're just, serving.
In 1930, Concord, California was a small but growing rural town with a population of just over 1,100 residents. The Caldecott Tunnel would not open for another 7 years, allowing easier access to Oakland and San Francisco and the nearest hospitals. Concord was a place where pear and walnut orchards dappled the countryside and everybody knew everyone. The Great Depression was in full swing and the local A&P store had been forced to drop prices 6.5%. A young spunky nurse by the name of Edna Gallagher Haywood had recently come to town, and with the help of a family member who believed in her and her compassion for others, she was able to open a 6-bed hospital in a small 2-bedroom bungalow at 2540 East Street, the site of John Muir Health's Concord Campus today.
She wasn't a big lady, but she was large and in charge. She didn't mess around, and it's funny because, my dad, he didn't get away with much if she was mad at him.
I'm Renee D. Crater, and my grandmother, Edna Gallagher Haywood, came to be with my grandfather, who was already in Concord. And one of the things that she was so enamored with was that there were oranges being grown in Concord, and she was so excited to be someplace where oranges grew.
It is amazing of what she amassed at such a young age. Probably need to give a lot of credit to that, probably to her parents. They must have done a really, really good job of raising her and, not to be afraid of anything.
Born in Elko, Canada, the petite yet fiery 19-year-old Edna Gallagher arrived in Concord, California in 1926. She was already a registered nurse and became married within the year to mailman James Haywood, whose parents owned a small gas station and some acreage on the outskirts of town on Willow Pass Road. By 1928, Edna had given birth to Francis Frank Haywood on the couple's kitchen table. Frank, or Sonny as his mother affectionately called him, grew up to be Jim and Edna's only son. Soon after their marriage, Jim met Dr. Henry Stirewalt, who had come to the area intending to retire on his walnut ranch. But when people discovered he was a doctor, they started going to him with their ills, and he found himself unable to turn them away. Once the good doctor found out Jim's wife was a registered nurse, he requested to meet her immediately.
So when she got there, she was already a nurse, graduated from Lethbridge, Canada, Galt Hospital.
She worked with a gentleman named Dr. Stirewalt, and he said to her one day, "You know what this town needs? It needs a hospital." And so my grandma got this idea, and it was during the Depression, and she called her father-in-law up.
Her father-in-law, my grandpa's dad, really believed in her. He thought she was a real pistol, and she was. So she went to him. He owned a small farm with acreage in Cow Hollow, which is a part of San Francisco. And he said, "I know you can do it, Edna. I know you can do it." And he gave her $1,200 to start the hospital.
And she got the loan from him, and she opened up this 6-bed hospital. And the story I always heard was that it wasn't really busy at first, and she was a bit worried.
So they had the hospital, and Dr. Stirewalt was there, and they were very fully equipped. They had an operating room, they had all the facilities, but there was no patients, there was nobody. So she decided at the Concord Parade, they needed some advertisement.
And so she told her husband, you need to go build a float, and she had these hot water bottles, these little mini hot water bottles that said Concord Hospital on them, and she threw them out during the parade.
With all the nurses were dressed in their nursing outfits, and pretty soon everybody knew that there was a hospital in town, and they came. And they came in droves.
If Edna Haywood were alive today to see how John Muir Health has evolved from the humble beginnings of the little 2-bedroom hospital that she developed in 1930, she would be amazed to see that we've evolved to be one of the leading preeminent hospital systems in the entire country. She would also be super proud to see how the nursing staff at John Muir Health are the key element to drive quality, patient satisfaction, patient experience, and they are really the heart and soul of our organization. Our vision remains true to Edna's original goal. John Muir Health exists to provide state-of-the-art healthcare to our community today and for generations to come.
Nurse Edna's compassion, her determination, and her unshakable commitment to excellence have paved the way for a better future for all of us. Please help us continue her legacy and support us in paving the way for the next generation of healthcare in our community.